Hi, this is Kirk, the Bariatric Carnivore. Well, you know, if you get diagnosed with a chronic disease, you know what that means to your doctor? Hawaiian vacation. There was an interesting article in today's Stat News report. And for those of you who aren't familiar with Stat News, it is a trade publication mostly aimed at doctors and people in the medical establishment. And they ran an article that talked about how United Healthcare's Advantage program back in 2020 ran this really glossy thing about how these practices, they were offering bonus systems for every senior that they could diagnose with a chronic disease. Because the way the Medicare Advantage program works is they are a private insurance company that gets money from the federal government. So every person that comes in sick and has a chronic disease, that's money for Medicare Advantage and money for the medical practice. Now you may be thinking, well, my doctor doesn't want me sick. Well, look, you got to realize something about doctors nowadays. They no longer work for themselves. They're employees. Most doctors in this country do not work for themselves. They are employees of large groups. The biggest employer in doctors is actually United Healthcare. About 10% of all doctors in this country work for them. Another big group of doctors works for CVS Health, which is a pharmaceutical dispenser. And there's a lot of private equity groups that are trying to buy up practices because, man, they are cash cows. Because we've got this perverse incentive system. And what's happened to medicine, and I didn't really realize it until somebody pointed it out to me, that starting somewhere about the 1960s, there's very little chronic disease in this country. And then third-party payers started taking over the system. A lot of private insurance. And that kind of began this progression. And it got worse when Ted Kennedy created HMOs back in the 1970s, and it's gotten significantly worse under Obamacare because the way the system is set up is there's no incentives for getting you healthy. You know, when a doctor used to run their own practice, they used to talk to patients about getting healthy because, frankly, chronic diseases were a pain in their side. It was, an expense. They were patients that required lots of work, and there was no real money in it. What they wanted to do was get you well, get you healthy, get you the heck out of the office. That's the way most practices worked until managed care and third-party payers kicked in. Now, all of a sudden, you've got this whole billing system and a whole bunch of perverse incentives that are not designed to get you healthy, but they prefer you to stay kind of sick. Not dead, that's bad. If you're healthy, you're of no use to them. But when you're just chronically sick and you need constant medical care, then you're a cash cow. And that's what they're willing to pay bonuses for. And that's what this article in Stat News showed. Was, they were paying serious bonuses to doctors that could get in a medical record that some elderly patient had some form of chronic disease. That's the sick system that we have. And this is why the system isn't telling you how to get healthy. I mean, realize that, please. If there's anything that will show you, as clear as can be, that the system is not incentivized to get you healthy, then take a look at this article. Get it down, and I'll put a link to a copy of it down below. Take a look at it and realize your chronic disease, which is part of a $4 trillion operation. The cost of taking care of chronic disease in this country is $4 trillion a year. That is a lot of sick incentive. And these are people that are not working to get you healthy. They are not going to talk to you about changing your diet. They're not going to talk to you about changing your lifestyle. They're not going to be talking to you about sleep. They're not going to be talking to you about anything. They want you just kind of chronically ill to be a patient for life. And it's sad, but that's just reality. And until you realize that and really grasp it, you're not going to understand why your doctor isn't talking to you about all this stuff that I'm talking to you about and what other influencers are talking to you about. We're really, I'm one of these people that was in that system. I was on 10 drugs every single day just to kind of make it through life. I was overweight, completely unhealthy, not really digging life. And thankfully, I had a wake-up call. I was told that I was going blind unless I lost weight. That's what began this journey over 10 years ago. And as I've found more about diet and made the lifestyle changes, I've gotten out of the system. And because I'm out of the system, I don't pay for it. And it's not bad. So take a look at it. Take a look at this thing, this clip. Realize that you are a commodity. And they want you sick. Because we have a very perverse system with bad incentives and no incentive to get you healthy. Please, if you like this message, hit the like and subscribe. Join this channel. Leave a comment down below. That helps the algorithm spread this message a little bit further so more people can see this. Realize that in this fight for your health, you are all alone. But we can all be alone in this together. I try to put out a couple messages each week. I will talk to you again soon.